So we're excited to kick off our panel on reproductive health and rights. Joining me on the panel are Stasia Obremskey, Managing Director at RH Capital, Shelley Alpern, Director of Corporate Engagement, Rhia Ventures, and Dr. Ushma Upadhyay, Professor in Residence at UCSF.
I am Dr. Ushma Upadhyay. I'm a professor and public health social scientist. I'm going to share with you today an example of how early academic research laid the groundwork for innovations in abortion care. But first, I'm going to share a little bit about abortion to give you an overview. There are nearly 1 million abortions in the United States per year. This is based on 2020 data. That's 1 in 5 pregnancies that end in abortion in the United States. Abortions recently increased between 2017 and 2020. So there is a large demand for abortion care. And while overall abortion has been increasing in the last few years, at the same time, the use of medication abortion has been increasing. So the proportion of all abortions that are medication abortions is over half, about 54% right now, and it continues to increase. So just to let you know, a medication abortion is the use of mifepristone followed by misoprostol 24 to 48 hours later. It can be used up to 11 or sometimes 12 weeks of pregnancy, and the misoprostol causes cramping and bleeding to start, and it is almost always effective. 95 to 97% of the time, the medications work to end a pregnancy. And medication abortion is extremely safe. It is safer than Viagra, safer than Tylenol, actually, it's also 14 times safer than carrying a pregnancy to term and going through childbirth and delivery. So as you all know, despite the huge demand for abortion services and its safety, in June of 2022, the Supreme Court overturned Roe versus Wade. And this means that there are no longer federal protections on the right to abortion. Currently, about 14 states ban all or most abortions, and you can see those states in this map here. So I came to start thinking about innovations in abortion care in 2018. Even before the Dobbs decision, there were already many barriers to abortion, with nearly 90% of counties without an abortion provider and 27 major cities that were deemed abortion deserts. So telehealth in this situation seems like an obvious solution. So in 2018, that year, I started submitting requests to the FDA to request that we approval to conduct clinical trials for a telehealth model of abortion without any in-person tests. They were not having it. They declined multiple requests. Even after an in-person meeting with FDA officials, they were not ready to approve the concept of an abortion without a pre-abortion ultrasound or other in-person tests. But when COVID hit, it really gave us the window we needed to finally evaluate no-test telehealth abortion in a real-world setting. Some clinics just jumped in and started offering the no-test model. We were in an emergency situation, and we're even offering curbside pickup for some patients, while others were offering the no-test model dispensing by mail. So we jumped in, quickly gathered the data, and we published findings on nearly 4,000 abortions offered this way, and found no significant differences in safety and effectiveness between in-person and telehealth visits. So by the fall of 2020, there were several virtual clinic startups in the space. Some of these are asynchronous, or some of these are synchronous, meaning it included real-time video chat with a patient, and others were asynchronous, which means most of the communication was done through secure messaging. So there was never a need to have a real-time conversation with a provider. So I teamed up with several of these startups and launched CHAT, the California Home Abortion by Telehealth Study, and to really understand the safety and effectiveness of both of those asynchronous and synchronous models. We started to evaluate the services in California, and we quickly expanded to 22 states. And since we started the study, even more telehealth companies have come into the scene and evolved across the country. And today this care is available in up to 24 states across the country, all of course protected access states. So at the Society of Family Planning Conference this year, we'll be unveiling chat study findings on safety and efficacy comparing synchronous and asynchronous telehealth models. And I'm going to leave you in a little bit of suspense until then. But what I can share with you is our findings on acceptability, whether it's synchronous or asynchronous. Patients are unequivocally satisfied with the convenience and the privacy that this model of care offers. So returning to people in states where abortion is banned, this telehealth for abortion is not legally available. And while medications cannot be dispensed to patients in banned states, patients are using creative methods to get these medications in legal ways. So they are using mail forwarding services. They are having the medications mailed to family and friends in protected access states and then having them send the medications. They're getting mailbox deliveries on the border so they don't have to travel quite as far into the protected access states like the New Mexico, Texas border. So we're planning and also fundraising now for future research on the use of such methods among people living in banned states. So thank you so much for having me, and thanks for your time.
Great. Thank you so much for that. And then let's transition to Shelley to talk about shareholder engagement.
I'm here from Rhia Ventures, as is Stasia Obremskey. And Rhia Ventures is a 501c3 developing a vibrant market for women's sexual, reproductive, and maternal health that contributes to equitable outcomes for all women and other birthing people in the United States. We use complementary strategies, direct investment through RH Capital, and Stasia will be talking about that, technical assistance, market analysis, field building, and corporate engagement is what I'm here to talk about. I'm the director of corporate engagement at Rhia. Our corporate engagement program for the last several years has worked with a network of about 40 institutional investors to engage with major companies to impress upon them the need to examine their policies around reproductive and maternal health care with an eye toward improving their policies through, we have spoken with several scores worth of companies over the last few years and filed close to 30 shareholder proposals, which have done well in terms of voter support. And as I'll talk about, we also used as a lever to drive change. We're going into the 2023 proxy season with an expanded campaign and an investor statement in the works that I'll talk more about. This slide shows some of our investor allies. It's not a complete list, but as you can see, they range from public pension funds to investment firms to religious asset owners and foundations and others. We produced a report called Hidden Value, the Business Case for Reproductive Health in 2020, and we updated it and re-released it just after the Dobbs decision overturning Roe versus Wade this past June. And there are a number of takeaways from this report. We identified 6 drivers that we believe argue persuasively to companies as to why they should be viewing reproductive health as a business issue. Perhaps the most obvious is that providing better benefits helps to widen the talent pipeline and help companies to attract talent. It will help support and retain existing employees. There is an economic impact, a negative economic impact when due to restrictions on access to abortion and contraception that has been felt for a number of decades. And our report includes some numbers of recent studies that have quantified that impact. Also, dollar for dollar, these are very smart investments and can keep healthcare costs down and help families, employees manage the timing of their when and how and if they choose to give birth, and with amazing impacts on their ability to control their careers. It also helps in meeting DEI goals because disparities in reproductive and maternal health care are felt most disproportionately in communities of color, and also helps companies prepare for greater scrutiny from a number of stakeholder groups, not merely investors like us, but from media, consumers, employees, and other groups. This is where you can find those reports, our URL at the top. We've also have a database on our website where we keep track of emerging best practices in this area. Now, what have we been asking of companies? Well, there isn't enough time to explore all of the things that we're talking to them about in depth, but in a nutshell, we're directing their attention to some low-hanging fruit in terms of insurance and benefits that they may have neglected. For example, covering all forms of birth control, not just those that are required by the Affordable Care Act, covering elective abortion, weighing in with lawmakers on public policies that could damage their states, economy and the well-being of their employees, and aligning their political donations accordingly. We've had some success in leveraging our proposals for real change. We've spurred some companies to take action and be more transparent about their political spending policies when they are misaligned with their organizational values. And we've helped to move 2 national retailers to cover out-of-state abortion travel for their employees. We're also working to bring the business case to legislators at the national and state levels. We've begun doing outreach to policymakers since 2020, and we've significantly ramped it up this year. Earlier this year, we sent a letter signed by 20 long-term institutional investors in the public markets with a combined AUM of over $300 billion to Fortune 1000 companies in the states where abortion bans have been under consideration for the 2022 legislative session. And this fall, we're concentrating our efforts on states where there are abortion-related ballot initiatives. This fall, it's proxy season, and we're filing proposals at a number of companies that focus on different angles. We're drawing attention, again, to the problematic political spending, insurance and benefits, hospital policies in abortion ban states, and protecting the personal health data of pregnant women. There are a couple of opportunities for investor action that I'd like to bring to your attention. One is an effort organized by a new group called VCs for Repro. They'll be running a full page ad early next week in the New York Times and possibly other outlets as well, with a very simple and direct message that criminalizing abortion violates human rights, it's anti-innovation, and it should be of concern to people who are investing in the economy. So I encourage you to contact the folks who are listed at the bottom of this slide to sign on to this statement. There is no cost for signing on to the statement, I should add. And I also want to encourage you all to get in touch with us so that we can share with you a forthcoming investor sign-on statement that is directed toward the institutional investor community, those who are invested in public securities. Now, this statement, although we are mostly focusing on investors in public securities, there's nothing in it that would be make it prohibitive or off message for VC investors to sign on to it as well. The release date for this is yet to be determined. It's not going to happen before the midterms, but there's a link at the bottom. I'll also put that in the chat window so you can contact us and we can follow up. And with that, thanks very much for your attention, and I will turn the mic over to Stasia.
I want to thank Scott for inviting both Ushma, Shelley, and I, who all come at this issue with different tools and techniques, but all a shared vision of improving reproductive health outcomes for women, whether it's through research, which is what Ushma is doing, or through public policy and using the power of public asset holders to try to move corporations in the direction of best practices, or whether it's our work at RH Capital, which is really focused on spurring innovation in the women's health space, really using the engine of venture capital to try to bring new technologies to the fore. Because as we know, women's health is a traditionally very underinvested in area. And so we haven't seen a lot of innovations, particularly in areas which could reduce the number of abortions, such as pregnancy prevention. Contraceptive technologies really have not moved very far in the last 60 years. The basic hormonal birth control pill was approved in 1960, and that mechanism of action is really still the predominant way that women manage their fertility to today. They're able to get those different kinds of hormones now and delivered in many different ways, but most of the innovation has occurred in the delivery of those hormones, not so much in what we call next generation non-hormonal methods. So one of the focuses of RH Capital has been, again, to find entrepreneurs, to find great science, and to provide venture funding to try to bring some of these innovations to market. I'm going to share my screen just to show two slides very quickly, if I can find my screen. I can't find it right now, so I think I'm just going to talk a little bit about the fund. So RH Capital Fund is a venture capital fund focused on innovations in reproductive health. My partner Elizabeth Bailey and I are the managing directors. We are just completing the fundraise for our second fund. It was a $30 million target fund, and we've raised $38 million from various investors. I will say the interest in our fund since the Dobbs decision has been quite impressive. I think a lot of investors who've been on the sideline were again looking for different ways to have impact, whether it's through grants for research or grants for organizations who are on the front line providing abortions, whether it's again supporting shareholder activism, or whether it's actually putting equity dollars into a venture fund which is specifically focused on pregnancy prevention and improving maternal health outcomes. That has been the focus of our fund since day one. So to date, we've invested in about 13 companies, which are either focused on next generation contraception or improving contraceptive access, or in technologies or services that improve maternal health maternal health outcomes. I'd just like to give a couple of examples of some of the companies that we have invested in, and I do this because, you know, if you work in this field, and given what Ushma showed in the map of the United States, you can get to be pretty depressed or disappointed about what's happening across the country. So when I feel that coming over me, I like to spend time with the entrepreneurs who are actually trying to develop next generation solutions for women, because they are really by definition very optimistic, very enthusiastic, and really looking towards the future. And so one of my favorite entrepreneurs working on a new pregnancy prevention innovation is a team based in Copenhagen, and they are trying to harness the natural barrier properties of cervical mucus and develop a on-demand contraceptive that for women. And again, if you look at the range of contraceptive available to women, there's really nothing. Most of them are systemic, means you have to take them every day in order to have a contraceptive efficacy. This product would be just at when you need it, and it would work quickly and work effectively to prevent pregnancy. The company recently, we were the first investment into the company. The company's called Circle Biomedical, and last month or 2 months ago, they signed a large licensing and development agreement with Organon, which is a spin out of Merck, really focused specifically on women's health. And so Organon now has provided them enough capital to move that program through the next stage of research and development, which is now in what we call preclinical. So there are some animal models and animal work that they're doing in order to apply to the FDA in order to undertake clinical trials, probably in the next 2 years. One of the other again, in addition to contraceptive, one of the other areas we're working on is in maternal health and trying to improve maternal health outcomes. We invested in a company called Bloom Life, which has developed a monitoring device for pregnant women to be able to conduct non-stress tests remotely. So that obviously during COVID, we all learned to do a lot of things remotely that we never thought we could do. And really pregnancy care, prenatal care has really not changed for many, many decades. And so this technology, particularly for women who are at high risk for preterm labor or other labor complications, are able to monitor themselves continually from the home and have that information provided to physicians or healthcare providers so that they either are in a hospital setting or they don't have to come in frequently for tests. So again, improving birth outcomes, because we know that particularly for women of color in this country, are 3 to 4 times more likely to have an adverse birth outcome, that these kind of technologies can really improve outcomes. And again, if you look at the data, the states which have the most restrictive abortion regulations also have the worst maternal health outcomes. So now in these states who have further choice and who women are going to have to carry a pregnancy to term, they are doing so in a really unhealthy and unsafe environment. So our fund's focus, again, is on pregnancy prevention, improving maternal health outcomes, with a particular interest in those companies that can address the needs of underserved communities. So I'll stop there. Happy to answer any questions or share any more information about the fund or any of our portfolio companies.
Great. Well, thank you all for your presentations. I really appreciate it very much. And I think a good starting point is first and foremost that I think most of us are parents. Most of us have children, and when we look at our children, we love them dearly. And so I think there's a kind of a misconception around this notion of contraceptions, pregnancy care, and let's just focus on those two areas. And why this kind of broader importance on reproductive health and care is so critical for just families. And it's really oriented towards supporting life, right?
I can start. I can just jump in that, we know that the majority of people seeking an abortion are already parents themselves. And many people seek reproductive autonomy. They seek the tools to control reproductive autonomy so that they can shape their families, be able to support their families, be able to support them economically as well as emotionally, and be available to their children.
Great. Anyone else?
No, my favorite line is that while women make up 50% of the population, we birth 100% of the population. And if you were thinking again strategically about where resources should be allocated, you would think that you would try to preserve the health and well-being of women because we are so vital to the society's reproduction. And that really hasn't been the case over time. When you look at the amount of funding either on the research side and on the venture capital side, and I'll share one statistic. So last year, the women's health area in venture, which is sometimes called femtech, celebrated the fact that something like $2 billion had been invested in women's health companies, which again, it was a big milestone, but that represented only 2% of all venture funding in healthcare. So again, we're still a drop in the bucket. There's still so many unmet needs across the spectrum, and there's still so much more capital that needs to come in to address the needs of women and families. And that includes men as well, because men benefit equally from, healthy reproductive health for women as women do.
Yeah, I would also just like to add to that everything that's been said, there's nothing controversial about it. It's really a majority viewpoint. In the 5 decades since Roe versus Wade the decision was handed down, public opinion polls have showed consistently that about 60 to 70% of the population has been supportive of that framework. And while there are, variations, in the public where it seems to be like an equal amount on either side, on some folks would tighten the restrictions, some folks would enhance the restrictions, but the overall framework and the endorsement of the idea that the ultimate decision is one for a woman to make, or another pregnant person to make with their doctors, that's not controversial in real life. It's only controversial in our political lives.
So I want to give each one of you your view or comment in terms of something that maybe you've already said, or something that you wish that you would like to share with others that's most critical. So if there's one thing that they have to leave with, and this is a message you want to share.
I guess I would just encourage people to be thinking outside of their boxes. So very often people think I do investment by day and I do philanthropy by night. And these two worlds don't mix. And we don't think about the different ways that our, that the hats we wear, they can actually be a little more expanded so that you can have social or an environmental impact with your investments. And so I would again draw your attention when you get the slides. Look at the opportunities for action that we are making available to you wearing your investor hat. It means something when you stand up as an investor and say, this means something to me, not just as a citizen, but as an investor.
And I would just echo that, I would say think creatively about how you use capital, and think about all the types of capital you can activate, whether it's grant making for some activities, whether it's equity capital, whether it's your for private investments, whether it's your public stocks, and whether it's your human capital, raise your voice, which is, again, very important forms of capital that we need to bring sort of our whole selves and our whole balance sheets to this issue of how to move the needle on improving reproductive health in the U.S.
And I'll just add, resist the thinking about these issues as women's health issues, because all of this affects all of us. This is all reproductive health. We all have it. We're all invested in the future, in people's ability to control the timing and the number of children they have, whether it's women or men. We all need all of the tools we can to grow our families in the way that is best for all of us. So think about these investments as investments in the future and reproductive autonomy.
Well, I want to thank our panelists for a terrific conversation on a very, very important topic. So please give them a round of applause. Continued discussion is going to be on longevity and survival. We're excited to transition to our next panel on senescent cells.